I think this is where most people probably look at the person in uniform and they probably say, okay, this is the guy who is now going to tell us we need to build more jails and make tougher laws. And that's not me. This is such an epidemic and we cannot arrest our way out of this mess. And I think the president touched on it briefly. What the president said earlier is true, because we want to arrest the violent drug. Dealers that are creating havoc in our communities. We have our share of violent crime. And we are very fortunate our drug task force, we have a great partnership with Inaudible. They fund so many of our efforts. So on a daily basis, the bad guy get arrested. We made a significant seizure yesterday. So we feel in law enforcement, as I'm sure our counterparts do. We really attack the supply side of this issue very well. And so we're not going to back down from that and we're going. To keep trying to remove people that are dangerous from society. But what's nice about this, and what I want to talk about, though, is attacking as a strategy the demand side. And that's what I think is very nice about this panel and this gathering. Because we've got a lot of things we can really talk about. We basically have a community of zombies, for lack of a better word, walking around. They need treatment very badly. And they're coming up to our officers, they actually are, some don't want help yet. But at some point they do want help. And we want to get them help. and a couple of the strategies that we've worked on that we want to attack the demand side. Not so much the supply in this conversation, is that we have trained our officers in naloxone. And that's been traditionally, up until very recently. Just something that our fire department and they do more of they can do the nasal and the 4. We trained all of our officers, regardless of their assignment. To be able to save somebody's life, administer the nasal and the rescue breathing mask that's accompanied. And again, that's paid for with Appalachian and such great partnership. They recognize that it's supply and demand. Interestingly, though, when I went to the roll call to start talking about this to the officers, first, they're kind of like, that might be more of a fire department role. That might be more, but as we talked more and I went down the line and said, well, has anybody have anybody affected by an addiction, and I've yet to go to one roll call, I've been to numerous. But I've yet to one where someone said no. Someone has said, yes, my sister, my aunt. And we've just got them mounted to our cars in the last week, so we don't have any success stories. And we don't want to have any stories, really, unless we want them all to be positive. But we know the fire department will continue to administer most of them in our camp. But we want to be in a position to save a life, much like a child drowning, and we can administer CPR. Another thing that we're doing that we're real proud of, and it's working with the United States Attorney. Which is the LEAD program, the Law Enforcement Assisted Diversion Program. and basically, since 2014. We've had 39, I'd call them low-level users, that were selling drugs to support their habits. And basically they're hit with a stark decision right at the arrest gate. You have an opportunity to go to jail, or you can seek immediate treatment. And of the 39 people that have taken us up on that, since 2014. Just one has been rearrested. I think that's pretty impressive. And that's a partnership with the U.S. Attorney's Office. And something that our officers are coming around to understanding what kind of problem we have. And I would just say, finally, because we do support everything Dr. Brumaj and the Kanawha County Health Department is doing with his harm reduction plan. And how we factor into that with the needle exchange program. Finally, we have a handle with care program that we piloted in 2013 in one school on the west side, then a second school, and now we do it for the whole city. I see some smiles in the crowd because there are teachers in here. But what we realized had been lost is when police officers go to crime scenes, what are they there for? They're there to take witness statements. They're there to arrest the so-called bad guy. And then they leave. But who is looking out for the children, the collateral damage? Who's looking out for the child that maybe is just trying to do his homework? Mom and dad are fighting. We come in, arrest dad. Mom cries. She's got to go to the hospital. And so that child gets left behind many, many times. And so we started a notification system to where the next day, our officers that are on the scene will send a notification to the principal or to the counselor, basically to say, handle that child with care today. Maybe that child needs an extra day before. Those are ways that we realize that we're not going to arrest our way out of this. We have our place and we can always use additional law enforcement resources. I'm not going to lie to you. Director Botticelli, thank you, Chief. I think that's an extraordinary example of your willingness and your partnership. I'm now going to turn to Susan Shumate from the Charleston Gazette. Who I believe is going to ask questions of the panel that come from the community. MS. Shumate, thank you for coming to West Virginia, Mr. President, Secretary Burwell, and Secretary Botticelli and the rest of the panel to address the chronic issue of opioid addiction. The Charleston Gazette now has done numerous stories over lots of years about this issue facing West Virginia. And we were able to solicit hundreds of questions. From our readers over the last 5 days for the President and the panel. And with us here is David and Kate Grubb with their question for the President. Question, first of all, Mom Carrie, there isn't a parent here who had a dry eye when you spoke. From your heart, you expressed exactly what we feel. And Danny knows this, too. Mr. President, I want to say that it is, and I'm going to take this opportunity It is wonderful to have an intelligent, caring, thoughtful person in your position. President Obama, thank you. Question, thank you so much for coming. This issue my wife and I, we have 5 daughters. Mr. President, you might relate a little bit to that. President Obama, I can relate to that. I don't know how you did 5. Question, and we live here in the East End. My second oldest daughter, Jessica, has been battling heroin addiction for 7 years. Ironically, the last time we were in this room was when our daughter was in the 8th grade. Here at Roosevelt and was a cheerleader. She made good grades. She was socially involved. Her future was bright. But as Jordan mentioned, her life got put on hold for a long time. Last month, the middle of August, our daughter overdosed. We found her in her bedroom, tourniquet on her arm, syringe next to her. She was already turning blue. My wife administered CPR. We called 911. While we were waiting, I held her and said, "Don't leave us yet." Fortunately, I want to say this to the chief, the response was amazing. Less than 5 minutes, the EMTs and the police officers were there. The police officers were sympathetic. They were helpful. The EMTs administering Narcan. Coupled with the CPR, saved our daughter's life. And she's now in recovery. This is her 4th time. It usually takes more than one time. And we think this one will be the one. We are full. Of hope. But we understand the pain in this room, the pain the families feel. The concern we have is access. Where do you get the treatment? How do you get the treatment? And, Carrie, you mentioned it? As soon as this overdose happened, we called hotlines and we got numbers to call and we called those numbers. And they said, well, there's a 3-month wait or, well. We don't take Medicaid cards or, this wasn't really the facility that could handle your type of problem. The other problem with Medicaid cards and things of that nature is you can't always go out of state. What if the facility is across the river? We're a border state, we need to be able to have that. Ability to go to the facility that may be best for our children. The bottom line is we need resources and we need to find a way to. Put those resources into effect so that we have the facilities. Because there's so many people that want help, like our daughter. But it took forever to find a place for her. Right now she's in Michigan. That was the best we could do. Why can't we have lots of these types of facilities with trained staff here in West Virginia, close to home? And lastly, I want to say one of the best provisions of the Affordable Care Act is that it does require coverage for drug treatment. And thank you for that. But one of the concerns is that if there aren't facilities available, then the treatment coverage can be illusory. So we have to close that gap.